Hey everybody, welcome to another episode of Voices of Verse Therapy. Today I'm thrilled to introduce Anna K. Ellison, an experienced SLP licensed in Florida, Indiana, and Virginia. She's kind of a Swiss Army knife. Anna K. brings extensive expertise in treating a ton of different speech and communication issues, so across a bunch of different settings. Anna K., thank you so much for joining us today.
Thank you. What a compliment. I love that Swiss Army knife. I'm excited to be on today.
Yeah, I mean, it's not just all the different types of clients that you've seen, it's all the different places that you've seen them too. It's really unique. So, definitely a strength that we've noticed since working with you. So, Anna Kay, let's start with your journey into speech pathology. You've worked in such a variety of settings. So, we got schools, private practice, nonprofit clinics, which is super interesting and one of the coolest things I remember when we met that I remembered, and even telehealth. So, you're able to be super effective throughout the entire migration to telehealth in the pandemic. I'd love to know what initially drew you to the field and how those experiences kind of shaped your approach to therapy.
Absolutely. I love sharing this story because it's so serendipitous and it's something that a really bad thing that happened that ended up with a super happy ending. So, my now husband was actually in a really bad car accident when he was 17 and ended up with a traumatic brain injury. And we were in high school. We are high school sweethearts. So, this was our prom night, junior prom. And he had just dropped me off at home and he was driving back to his house and he actually fell asleep at the wheel. So he was rushed to Vanderbilt Hospital. He had life-saving surgery. He was put into a medically induced coma for almost a month. That allowed his brain time to heal. And then once he was taken out of his coma, he required all the therapies to kind of get back to where he was pre-wreck. Right. So he needed speech therapy, physical therapy, occupational therapy, recreational therapy, all the therapies. That was his life for the next year after his accident. So I was a 16-year-old with no idea what I wanted to do when I graduated. I had started thinking about it a little bit, but I really didn't know what I wanted to do. And I was able to actually attend all of the therapy sessions with him. This happened, at the end of the year. So then it was the summertime. So I was out of school. I was able to attend those therapy sessions. And I really resonated with speech therapy. I loved how the speech therapist could work on multiple things, multiple aspects of communication all at the same time with one activity. And she was really able to challenge him to use his brain in new ways, learn how to answer questions in new ways, solve problems in new ways, express himself in new ways. And now I know that was an effort to actually heal his brain and to also create new neural pathways to take over the parts of his brain that might be damaged. So that's so interesting to me. Now here we are, 15 years later. My husband has no deficits at all. In fact, he works as a firefighter paramedic. And I fully credit, and so does he, we both fully credit speech therapy as the reason that he is able to communicate effectively and do his job.
Wow. So, is this something that you just knew going into college? You already had your major determined and everything like that?
Yes, absolutely. So that, like I said, I was 16, and so speech therapy changed me. I mean, being able to attend the therapy sessions with him. And so from right then on, as a junior in high school, I was like, this is what I'm going to do for sure. This is 100% what I'm going to do. So,
Oh my gosh, that's like a
yeah,
real calling. Wow.
right. Yeah, yeah. It's really cool.
And then geographically, did you guys stay in the same area for college? Have you just been together the entire time in the same place, or how did that all?
So we are both originally from Middle Tennessee. So just right outside of Nashville is where we were born and raised. And then his family has been coming to Florida since before he was born, had a place down here. He spent all of his summers, all of the holidays down here in Florida where we currently are. And so after high school, I followed him down here. I was like, I'm coming with you wherever you go. So that's why I'm in Florida today.
Wow. Yeah, I
Yeah.
think one of the other things that's super unique about your story is you'll hear about people that, like, if you looked at the distribution of ages and the different folks that kind of seek out speech therapy. I feel like Teenage in response to injury is like a very, very niche thing. So we'll hear about folks that got inspired through maybe like a geriatric experience, or folks that got inspired through maybe like a developmental experience. This is like very different,
Right.
acute, probably a very powerful experience for you. Thank you for sharing it, because I'd never heard that story before, and it's just crazy.
Yeah, yeah, absolutely.
Super cool. So another question I have for you is, do you find that certain environments or types of clients resonate more with you since you have this like broad experience? What's been a memorable experience that's shaped your passion for this type of work?
So I would say that I probably do gravitate more towards the medical side of speech and language therapy. I really like working with the brain injuries, the strokes, neurodegenerative diseases like Parkinson's, that kind of thing. And maybe that's because of how I found the field, but I also think it's just because I'm super interested in how resilient the brain is, and how therapy can literally create new pathways in the brain that did not exist before. So, as you know, I do gravitate more towards that. I had so many memorable experiences during the clinical rotation that I had with adults. That was at an outpatient clinic, and I got the opportunity to treat so many different types of communication and swallowing disorders. My supervisor, Stephanie Van Allen in Stewart, Florida, shout out to you. You really ignited my passion for this field. She took what I was already super passionate about because of how I found the field and just exploded it. So, working under her and under her supervision, I learned so much. And that was mostly with adults, and that was mostly medical. So, I'd say those are probably my most memorable experiences.
Nice, nice. I think it's a good segue into you treating this wide variety of disorders, including aphasia, cognitive communication disorders, and social communication challenges. What's your approach when you create treatment plans for all of these different complex needs? And are there specific strategies that you find especially effective?
Yeah, so with treatment plans, I have found it's super helpful and necessary to get a really thorough case history up front. That cannot be understated. With that case history, you're going to ask the patient what their goals are for therapy, the way that they want to see therapy go, what they want to get out of therapy. And then you can also involve their caregivers from the very beginning. You know, you're asking those questions, what their goals are, what the caregivers' goals are. And you really get a sense of where everybody is starting from. And then you're able to work with the patient and the families much more in depth. Then from there, I can help them shape very realistic goals of therapy. And they also feel like they have been heard. So that's building that relationship from day one. And that really helps shape my treatment plan as a whole. They feel like I'm truly providing a service to them because I am. And so that really determines how successful therapy ends up being. As far as specific treatment strategies, as you mentioned, I do treat a very wide variety of disorders. To name a few specific strategies, I think my favorite strategy that works across the board would be errorless learning. Again, I learned this from Stephanie Van Allen in my adult placement. So, errorless learning can be used no matter what disorder I'm treating, really, no matter what level the patient is. And it really helps to build confidence at the subconscious level for the patient. And so that patient feels really safe and comfortable to try. They feel like they are actually able to try with no judgment, no matter how difficult the activity or the assignment might be. So essentially, what errorless learning is a method of teaching in which the patient never makes a mistake. So that might seem impossible to implement, but basically, I use rephrasing and positive feedback to teach the patient without them feeling like they were wrong. So, an example of errorless learning would be if I asked a patient what color the sky was and they answered green, my response to that would be, the grass is green, right? Yeah, the grass is green. I asked what color is the sky? The sky is blue, right? Yeah, the sky's blue. Now you tell me, what color is the sky? Blue, that's right. So when the patient answered green, they were absolutely wrong. just plain wrong. But I never used any negative language. I didn't say, nope, that wasn't it, or no, that's not right, or try again, or anything like that. You don't use any of that negative language. You only provide reshaping and positive feedback. It's really hard. It took me a lot of practice to do that, but it's such an effective teaching strategy. And I feel like it just keeps that confidence up in the patient. And then you're able to model and kind of reshape the way that they feel about themselves and how successful they are in the therapy setting.
And you would say that across all of the different folks in the age spectrum or all the different types of conditions you've treated, this approach of just ongoing, like very positive reinforcement has basically always been optimal or, better than what you used to do, or like something that maybe a little bit more, I suppose, like on the constructive versus the positive feedback side.
Right. Yes. It works with little kids. It works with children that might be on the autism spectrum, kind of always keeping it positive, never making them feel like they got something wrong or they're, disappointing you because they said the wrong thing. You'd also be surprised how many adults really gravitate and do really well with this strategy. Like I said, it's kind of at a subconscious level that you're building their confidence up and they don't even realize what you're doing or that it's, building their confidence up. So I've seen great success with that.
Yeah, I suppose it would be something where you kind of start where it's errorless, or you have these false not errors, and then over time it's like actual positive feedback because they're just starting to actually get it
Right, right, exactly. You're teaching them, and you don't have to say no, you're wrong, if they're wrong. And they're learning more because they feel more comfortable and they feel more confident.
super cool.
Yeah.
And then is there any neurological explanation for that? Is there any research or academic version of this, or is it just you build people up, you get them momentum, it tends to work out?
No, there's actually some, there's neurological research. I can send you some articles to read about, the neurological effect of that errorless learning. So it's a little deeper than just building somebody up. It really does have a neurological impact.
Super cool. Yeah, we actually gets forgotten about a little bit, but our co-founder Danielle, she's a neuroscientist by training, so she would be
Wow, I did
really,
not realize that.
yeah, very very good researcher of the brain. Ended up in the world of SLP, or rather speech therapy, and I think she would really nerd out on that. So I'll be sure to share it with her.
Yeah, absolutely.
Nice. So we talked about different conditions. Let's talk about different ages across diagnoses. So you've worked with clients of all ages, from children to adults to everything in between, and all these conditions ranging from ASD to dementia. How do you adapt your methods across age groups to ensure that each treatment plan is effective as possible?
Yeah, so with me seeing such a vast age range of patients, it definitely can be challenging sometimes to adjust my mindset for the specific order that I'm going to be, or disorder that I'm going to be treating next. So, for example, when I was working in the nonprofit clinic, I would see a 2-year-old little girl, and then my very next patient would be a 78-year-old lady who had suffered a stroke. So it could be really challenging to shift my mindset and my practice. But I found that because I already had, developed very specific, very individualized treatment plans, as long as I was pulling tasks and activities that directly correlated with the goals that I had taken the time to create, the mindset shift kind of happened naturally. I think that comes with experience. I know that I probably would not have been successful trying to treat those two very different patients back to back when I first started out in the field. And now that I'm a bit more seasoned, if you will, I'm able to pull from my resource, treasure trove of things that I've collected over the years from all different people in all different settings. So that definitely helps.
Yeah, it's super interesting that you get to pick up on things with one population and apply them to the other. And I bet when it actually works, that's probably really eye-opening that something can work with someone who's like 80 plus as well as somebody who's, 10 and below.
right?
You've already talked about this with errorless learning, but I'd love to know if there's any other techniques that you find universally helpful, or do you typically adapt your methods based on the client's age and their developmental stage? Like, is it usually that out of the box, like, hey, let's apply errorless learning and apply all of these other like standard techniques, or do you find yourself getting really specific to each client based off of their age and condition?
Say it's probably a mix of both. The errorless learning is pretty universal. That can be implemented no matter what age the patient is or what level the patient is. That's one of those just kind of life skills. Also, beyond that, many strategies are so disorder specific. So it really does depend on the age and the stage of the patient, what communication deficits they have. The 2-year-old that I was working with has a chromosomal abnormality that she was born with, and it's very niche. It's very specific. Her brain did not develop, fully in the womb. So when you're working with that's habilitation, right? Versus stroke victim, that's rehabilitation because the brain was already there. Now it's injured. Now we have to either find a new neural pathway to take over for the damage, or we're actively healing the damage. So it really is very disorder specific a lot of times as far as which strategies I'm going to implement.
Have you ever seen a client like your younger client before? Like, was there a playbook for that? Or was that something where you were like, hey, we're going to have to dig in and just figure out a unique situation because this is kind of like brand new?
Again, it's a little bit of both. There usually is a very loose playbook of sorts, of here are 15 different research studies that have been done about this specific disorder, and here's what worked and here's what didn't. So, take with that what you will. But a really interesting thing about the brain is that it can work for 99 and then not the one, because as much as we have mapped out the brain, and we do know what parts of the brain are loosely responsible for what motor functions and speech functions and all of that. Everybody's brain is 100% individual. So, which is really great for rehabilitation because you can train other parts of the brain to take over if you have suffered a brain injury or a stroke, or you do have some type of, Parkinson's or dementia. You can train other parts of the brain to take over what that part of the brain can no longer do. So that's really cool. But when it comes to treatment, I would say working with kids is very gray because we don't really have a starting point. They were born with a lot of times they were born with whatever deficits they might present with. They have never been able to fully do that skill. They didn't fully have the developmental leaps and bounds that they should have. And so it's a lot of trial and error. It really is. And I think that's one of the reasons that children usually are in therapy for longer periods of time than adults. It takes a lot longer because you're going to try this strategy that's research based, evidence based, and you trial that for 6 weeks and you have no change. So, all right, back to the drawing board. Let's throw something else at them, And so it's a lot of trial and error versus with adults, it's a lot more black and white. First of all, a lot of times, almost all the time, they have had brain imaging. So we know exactly what part of their brain is affected. We know that it was normal before their injury and now it's not. So now we can, there's less strategies to throw at them. It's less trial and error. It's more black and white. This is what happened. This is the part of the brain that's affected, and this is the strategy to fix it. Boom. So, and I'm more of a black and white person. So I think that's another reason that I'm more drawn to that side of things, because it is less trial and error, and it is kind of like quicker and more success faster. So.
Yeah, I think that's something that we see on the business side at Verse as well. So for younger clients, we'll actually get folks who have kind of trialed through or cycled through like a set of SLPs, and they're just trying to find the person who really resonates with the kid. And I think that that's something that we as a company got to get better at, and like what we want to be like our main value prop, where it can almost serve as a directory and you can like learn about all the SLPs up front and be like, that's probably the person who's going to resonate the best with my kiddo because of XYZ.
Right.
Which, like, it's awesome that you guys have been able to give us all the specialties, the bios. I'm hoping that things like this, like, they can just look up Anna Kay and be like, that's somebody who takes this like very brain forward approach, which could be perfect for my kiddo. Like, we're just trying to get more and more information out there so that people can kind of shop around a little bit better and make a really informed decision.
Absolutely.
Yeah. So I'd love to get into specific conditions. Cognitive communication and social skills challenges require both practical support and confidence building. So it's kind of a multifaceted game. How do you help clients develop these skills in a way that translates even outside of your sessions?
So I would say that cognitive communication skills are certainly easier for me to treat and target in a one-on-one therapy session. They're easier than social skills to treat, one-on-one. We work on very nitty-gritty, very specific tasks and activities that are helping create new neural pathways in the brain, right? So that translates into the big area of the brain overall functioning better. So completing a task, working memory of recalling 5 words after a 5-minute distraction activity. That translates into strengthening and healing the part of your brain that's responsible for focus, that's responsible for divided attention. And those are both skills that we all need on a daily basis just to be a functioning member of society, right? So it's like I've said before, it's a lot more black and white versus social skills. I'll do a lot of skits and role play activities, but I do often find that after a few sessions, the patient is a little too comfortable with me. And so the role play isn't as effective. They're not struggling as much because it's me. So that's when I create homework assignments. So like, for example, the patient has to have a conversation with a family member. That's at least 5 conversational exchanges, 5 back and forths. And within those 5 back and forths, the patient has to ask at least one follow-up question to something that the family member said. And they have to video it. There has to be video proof. So my therapy session then will focus on teaching the communication strategies that then they are going to go implement outside of the therapy session. So then, as the patient's social skills continue to improve, their homework might get more and more difficult. So now you have to go have a conversation with the waiter at the restaurant or the cashier at the game store that you always go to, very real world things.
Okay. That's actually really interesting. So there's almost like a ceiling of how well they can do socially when it's just you, because they kind of overcome their shyness. But your
Right.
ultimate goal is like, how can you get these folks to be able to share themselves with the world to people that they've like never even met before, or that they have like less of a relationship with. Um, that's really cool. I was going to ask you about how you track progress with that, but the videos make a ton of sense. Is it something where you have something that you're looking for in a set of videos, like, hey, these are level 1 interactions and I have to feel confident that you're kind of crushing it with these, and then you move on to like level 2 interactions? Like, what does that even look like, and how do you figure out what's, I don't know, maybe a more tall task for a kiddo as they get better and better at this stuff?
Right. So a lot of children on the autism spectrum have difficulty with topic maintenance. For example, you can ask them a direct question, or you guys can be talking about a very specific topic, and then something might pop into their head and they automatically want to start talking about something different. So and it's abrupt. A lot of times it can be very abrupt. So I'm looking for topic maintenance. I'm looking for you're not interrupting your conversation partner. You let them finish what they are saying before you start talking. These are all the very, like you said, level one type things. And so that's why I start with a very familiar person that we can work on those level one communication skills with. And then we'll watch that video back. The next therapy session after, we'll watch that video back, and it's really nice because you can pause, you can rewind, you can fast forward, whatever. And we talk about, like, I really like how asked them, that shows that you were listening, that you were able to then ask them a question about X, Y, and Z. You were listening to them. And then, or did you hear that they weren't fully done talking before you started talking? So next time, make sure that you stay quiet, hold your question in your head until they're done.
Totally, yeah. I feel like I could use that kind of help with just these podcasts. It's applicable to a lot of people. Yeah, so I try to put out a bunch of content for us and do like a daily reel or TikTok and all of this. And I was really stoked to know that we have like multiple creators in our client like caseload at first. So we have multiple kids who just want to get better at doing this kind of stuff, which kind of fires me up because I struggle with the exact same thing, like getting in front of the camera and being able to like make coherent thoughts or, like have a conversation that's free flowing. And like there's kind of like the scripted you. There's also like the fully authentic you. And I feel like the people who are better and better at the content game can kind of like share their fully authentic self without having to be on script too much. And that's like everybody now in 2024 that is trying to, get into this side. Like for me, I don't know, I'm much more on like the businessy side, on the contenty side, and I still find the same lessons like extremely relevant because it's just like finding ways to share your authentic self with the world. Like everybody kind of struggles with this, and it just seems to be getting like more and more relevant as we share more and more stuff online. Kind of a yap, sorry. Yeah, super cool. We had one client, without getting into too much detail, we just wanted to be able to make better YouTube videos. I was like, dude, I have the same exact issue where I just want to have like better narrations, be able to like share me instead of like the reading off of the teleprompter me. And you got to have like kind of a combination of the two. But cool. So moving on to swallowing and voice. So swallowing and voice disorders can be deeply impactful to someone's day-to-day life. How do you approach treatment for these areas, and what strategies do you use to help clients maintain functionality as well as their confidence? When you go through that, it just kind of blows my mind that I think being a speech language pathologist might be the only job in existence where like if people heard you just say what you do and they couldn't see your LinkedIn or whatever, they could mistake you for a nurse practitioner, nurse doctor, or a teacher. Like just depending on which direction you want to go with it, and the fact that there's some people that have so much range that they can go both sides, from the super heavy clinical to the more like developmental. It's just very very impressive. So let's move on to individualizing treatment, which we've chatted about a little bit already, as well as getting the family involved. So building strong connections with clients and their families is clearly a huge priority for you. And it's something that you're able to empathize with directly in your lived experience with speech. Could you share more about how you involve families in therapy and why you believe this is so important to the success of your treatment plans? Totally. And when you say, your family puts their life on hold, when we look at the timeline of when this happened, this is well over pre-pandemic when going to another geography, no matter what your job was like a very very big deal. It's like actually putting your life on hold. There's not really a norm of just logging into a Zoom to be able to do what you were doing. So it is like this really big commitment, and also I think it's a pretty solid segue into that period. I'd love to hear how you were able to adapt what you were doing once telehealth became a thing. So offering telehealth brings unique challenges as well as opportunities, especially to see folks in communities that might not be as staffed up. How do you adapt therapy sessions to the virtual format, and what do you do to keep the personal connection strong even though you're working over a video? 100%. Yeah, one of the hacks, I guess, that I had when we had to migrate to the Zoom world over and like I was in big tech for a while, and that kind of really took over how people worked for about 4 or 5 years. I take the zoom and I make sure that my window is as close to the camera as possible so that if I'm just like drifting off or having like a bad hair day or something like that, I'm like forced to look, which is really stupid, but I think it did help a lot in just like making it feel more like a real conversation. Or I'll take like, their screen and put it directly next to the camera so it's kind of like right by each other. So respect. I'm glad that you caught on to that as well. I think the other thing, like you didn't necessarily mention this, but it's obvious based off of this call, like investing in technology, right? It's like you spend, whatever you end up spending on a microphone or a camera. Like I have a DSLR camera, you have your audio tools. Those are relatively small investments when you look at it as like, hey, I'm going to be seeing 20 clients this week this way, and like this is a way for me to really stick out, right? So like just putting in the investment to present your virtual self a little bit better is quite helpful. Yeah. So let's get back to your range. You specialize in such a broad range of these areas. We chatted about swelling, we chatted about communication, socializing. How do you stay organized and up to date with all of these different things, right? Like you even talked about like anatomy, neuroscience. Are there any resources or practices that you rely on to ensure that you're bringing the latest knowledge to each session? Yeah, and even we've even had clients who have gotten to the level of CEUs where we've had like a fluency client who was going through the different SLPs that we had in their state. And they wanted to know the exact CEUs that our folks had taken to be able to make the decision who would be best for them. Yeah, so it's definitely a thing. Might be something that we have to highlight at some point because it could definitely help people make the right choice. Nice. And then let's switch to the fun stuff before we wrap up here. Outside of work, hear that you're often by the beach or the pool with your family. Probably super typical down by where you live. How do you balance your professional demands with your personal time, being a mom, and what are some of the ways that you like to recharge? Nice. Yeah, I personally think that you live in a really great place to recharge. I think you have the just off of my experience whenever I've gone over there, like, you have the right combo where you get access to nature and things where if you just like stare at it, it's gonna make you feel pretty good. But the difference between where you're at and like where I'm at in California is I'll try to have my moment with nature and I'll like look to my left and my right and there's like 30 other people doing the exact same thing. And you feel very much like, crammed in there. And it can kind of make you, I don't know, just always in the city mode here. Like you always feel like, you gotta be here and there, and there's a little bit of like a tension. Florida's a place where I feel like you can actually let go a little bit, and there's like there's a little bit more like peace of mind down there, if that makes sense. At least based off what I've seen. Nice. Do you think you'd ever go back to Tennessee, or are you a Florida lifer at this point? Nice, nice. You surf at all? It's very nice. Well, thank you so much, Anna Kay, for sharing all of this. So many thoughts, so many insights. I'm like really glad with how deep we're able to go here. I just thought like getting into the neuroscience part of this was like really unique and something that we haven't talked too much about on the pod yet. So thank you for kind of like steering us in that direction with the conversation. Your dedication is like super inspiring to us as a team. And I'm sure that our listeners will appreciate the depth that you bring to your practice and all of the different folks that you're able to see because you put in the work in, you put the work in. So super grateful to have had this time with you. Awesome.